So we have quite complex and severe head injuries that we deal with. Those individuals may require a specialized inpatient stay. We have 2 specialized units that focus on retraining these individuals, addressing their physical, cognitive, emotional, and behavioral needs following their injury, and putting them through a comprehensive rehabilitation program that will allow them to progress to the next stage of their recovery. We also have outreach programs, and these individuals are advanced rehab therapists who work with the patients, transitioning back into home, back into school, developing strategies and coping strategies so that these individuals can return to a meaningful, productive life.
So my role as a KIC is mostly I go out to assess people in their own situation. So it could be a hospital or a home or different areas, and sometimes we work with a concussion clinic as well to do that. But what we're able to do as a KIC is look at what is the situation, what's the problem, how are we going to set goals, and then meet them, and then help follow them. I follow people. I've had someone I think for 12 years now.
So specifically, Brain Injury Services tries to help with that navigation through the healthcare system. We understand it's complex. A lot of people with concussions, unfortunately, are not their best selves, and they have to be able to navigate and understand a lot of different and new research that's out there to help them. We also help them with kind of memory tasks or concentration tasks or focus tasks, and we do that like by playing games on the iPad. And then I'm there to reach out to at all times. So I have clients that will text me at 8 o'clock at night because they're feeling really anxious, and we know that with concussions, you know, mental health and feelings like that can really get aggravated. So it's just kind of help to kind of take it down a little bit and help them get through that moment, and remind them that everything's going to be okay.
Working with Kristen and Brain Injury Services has been a total game changer. I didn't have an advocate before, and I wasn't very good at advocating for myself and feeling kind of lost. And one of the first things that she did was kind of normalize what I was going through.
Some other initiatives is some of our clients are still going through the school system, so we try to help make accommodations, and no one really understands what their concussion symptoms are like and how do they adapt to them. And I help to explain what is the brain injury and what are the symptoms and what would help this client learn. And I only have to really do that one meeting and they take off running. Those teachers are extremely creative to help the clients kind of get through their class, get their homework completed.
It all started with support groups, which has continued, but the support groups are kind of the core of it all, and it's the chance for the survivors to come out and connect with others who are just like them, so that they don't have to feel alone.
When it's someone's first time, you go through the story of your accident and what happened, which is nice because you find out what everyone's problems are, what their difficulties are, and how they overcome them. This place saved my life. I was so down and depressed, I had no purpose. Everyone cares. We've all got the same issues but different. We can help each other and do so much for each other without knowing it. I mean, I look normal. It looks like there's nothing wrong with me. I mean, brain injury is the invisible disability.
I'm not walking alone. I'm walking with people who will walk with me and listen to me and come down to my level, instead of having to go up to their level.
I was in a head-on collision 8 years ago. They didn't expect me to walk or talk ever again. I had to live at Bish, which is sort of like a sister place with the HBIA. It's Brain Injury Services. They offer a place called Transitional Living. So while I was rehabilitating, I lived there for 4 years. And I had staff that looked after me for 24 hours a day. Staff there that thought it would be a good idea for me to come out and meet some other people with brain injury, because I was very depressed. But the most loving and wonderful people I've ever met in my life.
A lot of the survivors have actually come back and saying that support groups are like an extension of their therapy. That, you know, they get to have the rehab team and, you know, all the doctors and medical team and their, you know, extended team helping them to recover, but having the support groups extends on that.
40% of serious brain injuries we know are caused by falls. So by preventing falls, we're preventing brain injuries.
It's a group of over 20 organizations and community services that work together to prevent falls in the older adults in Hamilton. So the reason we talk about stairs a lot is because 50% of falls at home occur on stairs, and so being able to navigate the stairs, go up and down the stairs safely is incredibly important.
This is the 23rd Annual Conference on Neurobehavioral Rehabilitation and Acquired Brain Injury, and it's put on by Hamilton Health Sciences, and it's a really important educational event that is bringing the experts in the field of acquired brain injury from both locally and internationally here to speak on the latest advances in research and practice.
We have to be really conscious of the fact we have a whole bunch of people that are doing the best they can with very limited resource. So we have to collaborate with them in a way, because one thing I know is I'm leaving. We're all leaving. And if I know I'm leaving, I better spend all my effort not just showing how I can do this, but I better damn well show the mother, sister, brother, whoever it might be, friend, how they can do something like this. Not exactly the way I do it, but something like it.